This is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about 28th May 2022 OET exam, in which I'm going to discuss with you all about OET writing as well as speaking. Okay, so let's move on to the topic. So what is the letter today? They have asked. The letter is a known case letter. So what is the patient name? Patient name is Mrs. McCarthy. I'm sorry, this time also I didn't get the second name of the patient because my students has given me only Mrs. McCarthy. And the patient admitted because of the fall from the retirement home to hospital. And what happened because of the fall? Patient diagnosed with compound fracture, especially patient tibia had a fracture. And also patient gone for the surgery to correct the fracture, and patient like the affected part of the limb was supported with plaster of Paris. Post-operatively, patient developed hospital-acquired pneumonia, which was treated conservatively. And also patient developed low mood and dehydration, weakness, and this all corrected with the conservative managements. And patient social background patient lives in retirement home. So it is a known case. We are writing to a community nurse, Mr. Peter, who is in retirement home. So we are just updating the current condition of Mrs. McCarthy, and also we are writing an advice, discharge advice to Mr. Peter that what they have to do once Mrs. McCarthy reaches the retirement home. And apart from that, what is the discharge advice? Leg elevation, assistance for activities of daily living, pressure area management, and follow up at outpatient department, and also look for signs of compartment syndrome, and also provide or encourage the patient to take adequate oral and fluid intake, and also patients to avoid weightlifting. So these are the advice they have written as a discharge plan. So now let's move on to the letter. How exactly this letter has to write? First of all, as usual, introduction. To write an introduction, we need three things. One is patient full name, and second, purpose, and the third one, what is the patient condition, current condition. So here we can write it as it is a known case letter. So we are just updating the current condition of Mrs. McCarthy. Am I right? So I'm writing to update the current condition of Mrs. McCarthy, who requires continuity of care and management at your service. Full stop. She had fracture, she had a fracture. So what they have done, which means surgical repair. So who has undergone surgical repair of fracture? Either you can write like this, or who is recuperating from hospital acquired pneumonia. Like that also we can write it. And coming to the point of present medical history. So known case, which means the main thing is it is not necessary to write about social background, past medical history, and the medication history. So thereby, since the day of admission to until discharge, what are the things that we have done to the patient, how the patient reacted to the treatment, and what is the prognosis. So that is the thing we are just writing it in elaborately as a 2 paragraph. Okay, so let's move on to the second paragraph. It's a body paragraph, present medical history. So of course, from the retirement home only, Mrs. McCarthy got admitted to the hospital. So they knows about that fall, but after the fall, what happened at the hospital, they does not know. So we can start the paragraph as you aware, comma, Mrs. McCarthy was admitted on this day following a fall at retirement home. On assessment, she was found to have compound fracture, especially the tibial fracture. And then what else we have done? Therefore, she has undergone so-and-so surgery, and the affected part was supported with plaster of Paris. Unfortunately, Mrs. McCarthy developed hospital-acquired pneumonia post-operatively. So thereby what happened, as evidenced by shortness of breath and increased respiratory rate, increased white cell counts, and also she has tachycardia, and also she was suffered with the shortness of breath and decreased saturation. And then also what they have noticed, in addition, she was found to have low mood, dehydration, and weakness. Consequently, she was treated with conservative managements such as oral fluid and adequate dietary intake. Along with that, she was provided with analgesics coding. Okay, and now we are set to be discharged. So how we can write? As her viral inflammatory markers back to normal or became normal, she is due for, otherwise she is being discharged today, or what is the date of discharge they have given, we have to write it. So this much information we are segregating as a two passage because we don't have the social background and we are just writing it elaborately in understanding manner. Okay. Now coming to the discharge advice. So what we will write it in the discharge advice? So we are just telling them in a requesting way to follow the care that what we have done to Mrs. McCarthy, right? So in view of the above, kindly elevate her legs and look for signs of compartment syndrome, which includes discoloration, pain, redness, numbness, these are those things. And second one, please assist her in activities of daily living such as showering, toileting and dressing. And what is the next? So next thing is we have to make sure them that McCarthy is having any pressure sore or not. So they can say, you can write it as most importantly, change position or promote her to mobilize to prevent pressure sores. Because of the fracture, patient unable to mobilize often and which leads to pressure sores. So which have to be promoted by the nurse who is looking after Mrs. McCarthy at retirement home. Okay, another thing is we have to say, please note that or kindly ensure that McCarthy has an outpatient review until the plaster of Paris removal. So when the plaster of Paris removal? After 6 weeks. And apart from that, we have to tell them most significantly try to avoid weightlifting for at least 6 weeks. And next thing is they have to observe the plaster of Paris, because in case if the plaster of Paris is getting wet or it is something happened to the plaster of Paris which may cause infection, swelling, redness, itchiness to Mrs. McCarthy. So they have to make sure with the plaster of Paris. So these are the advice that we are writing in the discharge plan. And after that conclusion, please contact me for further details. And there is a name they have given in the address. So we have to conclude yours sincerely. Then we are the charge nurse who is looking after McCarthy and hospital. So we have to complete with charge nurse. So it's a very simple and known case letter, and the informations also was very simple informations which is more understandable. Also we able to write it in a very organized way, in a very good way without any grammar mistakes, as well as the informations also can be allocated in a very good way, because only introduction, present medical history paragraph and discharge, which means the recommendation paragraph, and conclusion winding the letter. So that's it, because it's a known case letter, not necessary to include the social background, as well as that it is not necessary for us to include the past medical history as well as the medication history. As I said that in the present medical history, patient was having low mood and depression. So because of that, after she reached the retirement home, the nurse can enhance or nurse can encourage or promote the person to close contact with the family members, so that it will prevent the low mood, or it will make the patient to happier and overcome the depression. Okay, so these are the points that we need to mainly write it in our OET writing. Now coming to the point of speaking. So what topic they have asked? It's a very simple topic. It's a familiar topic to all also. So the topic is, one is seizure, and second thing is nose bleeding, and third one is ringworm and sepsis. Because of the catheter, the patient developed sepsis. And these are the simple common topic which is so familiar topic also to everyone. And I hope you all have done in a very good way. Hope for the best result. And whomever wants to join for our class, we have mock batch and we have beginners 40 days, 60 days and 30 days classes. Whomever wants to join for our class, our number has given in our description. So please contact us